Hello everyone, my name is Stephanie. I'm an independent audiologist with Audiology. We're a small business with clinic locations in Capalaba and Hamilton, and we're here to help the community with audiology services. Today we're going to talk about something that everybody produces, but some people might have some issues with at some point in their lives, and that would be earwax. Whether you're just interested in learning a little bit more about wax, you are wondering how best to effectively clean your ears, or you're dealing with excess wax, please stick around because we're going to discuss everything that you need to know in this video. Earwax is also known as cerumen medically. It is very complex and it's produced by specialized glands in the outer third portion of your ear. These glands are called ceruminous glands and sebaceous glands, and they work together to help produce what we know as earwax. So earwax is made up of several components. Lipids or fats are produced by sebaceous glands, and they provide the waterproofing to wax. Secretions from ceruminous glands give wax that sticky consistency. Earwax also consists of dead skin cells that are just naturally shedding from your ear canal, and there are also antimicrobial and antifungal properties within the wax to help protect against bacteria and fungi. There are two types of wax, wet wax and dry wax. Wet wax is traditionally produced by those of African or European descent and tends to be more wet and amber or brown in color. And then dry wax tends to be produced by those of East Asian descent and is usually much more flaky and tends to be more like a grey kind of color. Most people think that earwax is just something that needs to be cleaned out of your ear. However, it actually serves multiple protective functions. So the first function is that it acts as just a natural barrier for your ears. It will trap dust, dirt, debris, even small insects, and they stop it from reaching your sensitive eardrum. Earwax is slightly acidic, about a 4 or a 5, and this creates a hostile environment that is harmful to bacteria and fungi, and that's how we have that antimicrobial protection. Earwax also provides lubrication for your skin inside of your ear, and this prevents it from becoming dry or cracked. That's particularly important because the ear canal skin is really quite thin and delicate, and the sticky consistency of wax will help capture any particles and act as your ear's natural cleaning system. So on that topic, your ears are actually self-cleaning. The primary mechanism is called epithelial migration. The skin of your ear canal grows in a unique pattern, starting from the eardrum and then making its way out to the outer portion of your ear canal. The whole process takes about 2 to 3 months. Your jaw movements will also play a crucial role of moving the wax out of your ear canals. Every time you chew, talk, yawn, or use your jaw, the motion helps to massage the ear canal and it encourages the wax to move outward. This is because the ear canal isn't just a straight line, it's actually got 2 bends in it, similar to an S-shaped curve, and the jaw movements can help move the wax through those curves. Under normal circumstances, once the earwax reaches the outer portion of your ear, it'll just fall out or be washed away during your routine bathing practices. There are several factors that can affect your earwax production and removal. Age is a significant factor because as we get older, the earwax tends to become drier and harder, and this leaves you more at risk of getting impacted wax. Some people are also just genetically predisposed to producing more wax, and other people might have narrower ear canals, which means that it's harder for the wax to make its way through those curves. Things like hearing aid usage, earplugs or earbuds can interfere with the natural wax migration out of the ear, and certain skin conditions like eczema or psoriasis can also affect wax consistency, and environmental factors like humidity can also affect wax consistency or production. In Australia, we have a hot climate, and that usually means that earwax is going to become more runny in consistency. However, with excessive sweating, you may actually start to produce more wax. You should be concerned about earwax when you experience any ear fullness or ear pain, any dizziness or vertigo, tinnitus, any pressure inside the ear canal, or persistent itching. If you are noticing any of those symptoms, it's time to see a professional rather than trying to handle it yourself. Let's address some dangerous myths about ear cleaning. The biggest myth is that cotton buds or Q-tips are safe for ear cleaning. The reality is that they actually push the wax deeper into the canal, and that can then leave you more at risk of impaction. The ear canal is also only about 2.5 centimeters long. The eardrum is surprisingly easy to reach, and cotton swabs can actually damage the eardrum itself. Another dangerous practice with no scientific support would be ear candling. The hollow candles supposedly create suction to remove the wax, but the studies are showing that they don't remove earwax and can actually leave candle wax inside the ear, cause burns, or cause damage to the eardrum. Something I commonly hear in my clinic is the use of keys or bobby pins or other small objects being inserted inside the ear canal. They should never be inserted because they can cause injury, especially to the eardrum. And even at-home methods like irrigation can be dangerous, especially if you do have a perforated eardrum or if there are other ear conditions that you're not aware of. So what can you do safely at home? The golden rule is to never stick anything smaller than your elbow inside your ear. So for external cleaning, you simply just need to use a washcloth to wipe your pinner. If you feel you have excess wax, there are over-the-counter drops that you can use to help soften the wax, and these usually contain something like hydrogen peroxide or mineral oil. What these drops will do is they'll help to soften the wax, which allows the wax to move out of the ear on its own, or if you use them and then see a professional, it makes it easier for the professional to actually remove the wax from your ear. The key difference with a professional removal is that we can examine your ear first, and we usually have earwax removal training. It is important that we examine the eardrum first to make sure that it is intact and that there are no other underlying issues. It's also important to use proper technique and sterile instruments. We can also identify if something that appears as a wax problem is something else entirely. So remember, earwax is completely normal and healthy. It's your ear's natural cleaning and protection system. Many people will not need professional wax removal, but when the time comes for those that do, it is best to leave it to the professionals. If you're experiencing any of the symptoms that we did discuss today, please don't hesitate to reach out to ER Audiology. We're here to help keep your hearing healthy and your ears clean. Thanks for watching. Don't forget to subscribe to our channel, and until next time, take care of your ears.